Do we have a standard? Do we have an index of priorities? For example, in organ donation, we have priorities. Give to the younger person or the more fitter person.
Same goes with the ICU.
Is that documented?
हमारे उसके हमने उसके अपने ICU के अंदर मैंने अपनी ICU में एक पेपर पे फॉर्मेट बना के दिया हुआ है और डॉक्टर्स को कि भी ये डिजीज फॉर एग्जांपल इवन meningitis even somebody for example a patient comes in with जो पहला सिनेरियो वाला है उसको वेंटिलेटर बेड नहीं मिलेगा और वेंटिलेटर बेड अगले डिफॉल्ट की तरफ चला जाएगा। देखिए एक दिन में 6 पेशेंट्स ने आना है जिनको आईसीयू की जरूरत है। अब अभी आज मुझे कॉल आई कि जी एक 22-year-old है cavernous venous thrombosis है which is again from I can understand you guys will not but there is maybe a belief chance there is a chance give her the chance। देखिए अब कोई आ जाता है जिस तरह से ये सिनेरियो है फ्रॉम माय पॉइंट ऑफ व्यू मैंने एग्री उस पार्ट पे नहीं किया ये फ्यूचर ट्रीटमेंट में बट इस पार्ट पे तो मैं एग्री करता हूँ कि दिस ट्रीटमेंट विल ओनली prolong an 88-year-old for maybe a few days or for a few weeks and bedridden status के साथ वो एग्री करेगी which ठीक है उनकी। देखिए एक पेशेंट की फैमिली जब है ना उसको तो देखिए you have to think about it इसने तो चली जाए दूसरे ने जिंदा रहना जिसने जिंदा रहना उसने इस गिल्ट के साथ अगर जिंदा रहना है कि मैंने 2 और शॉक्स नहीं कराए थे उससे बेहतर है कि 2 और शॉक्स दे दो उसको। मतलब उसको आपको दोनों तरीके से सोचना है। मतलब मैं आई कैन गिव यू अ लॉट ऑफ एग्जांपल्स कि जब आप किसी को ये कह के फ्यूटाइल कह के भी रोकते हैं ना उसके ज़हन में रह जाता है कि भी मैं अगर ये कर लेता तो ये हो जाएगा। सो every scenario it is ICU की तरफ से मैं I can understand कि they are looking at life and death every minute। कई दफा मेरी फैमिली कहती है बाबा आप तो फोन पे बात कर रहे होते हैं और किसी की डेथ के ऊपर बात कर रहे होते हैं। ठीक है that is what ICU is।
इसमें to your question sticking to your question इसमें 2 चीजें हैं। एक तो है फिर going down this road government also needs to be aware that this is very costly। Either take a decision at a national level that in Pakistan healthcare will not go beyond this। Because you have this scenario where you have an ICU with 6 ventilators and you have patients coming through. Now your question was that you have this 88-year-old lady on a ventilator and a 22-year-old comes after a road traffic accident, he's had his surgery and he's likely to survive when he needs a ventilator। He's 22 and he has a long life ahead। Do you switch this off and put him on? I can't do that as a doctor. I just can't. From a legal perspective, I can't switch this woman off the ventilator and put the young man on it. From my own personal, ethical, moral perspective, I can't. I'm also a human being. I'm not going to switch anybody's life off. Yes, if you meaning the nation, the government steps in with parliamentary legislation, you will strengthen me. Because I know now I'm acting on your behalf, not on my own behalf, to terminate this or switch this off and give it to a young person. So either come up with some legislation which will strengthen me, knowing it's not my decision, I will not have to face the consequences of this decision. It's a national circumstances, but this is what we do. Or we will have to leave her on the ventilator and try and find a young person somewhere, something alternative. Or the government steps in and arranges a ventilator for us. But certainly you can't switch off the life.
You got to pick and choose yourself. It's on a first come first serve basis, basically.
No, if you have if this patient was not on the ventilator, if the patient was not on the ventilator and was both were getting intubated, the ventilator will go to the younger one।
So there is a system.
अगर वेंटिलेटर जो ऑलरेडी है तो वो स्विच ऑफ नहीं होगा। स्विच ऑफ नहीं हम कर सकते।
We don't have a legal
Again, personally to me this is a thing playing God। I am thinking that the old one is going to die because she's old earlier than the young one। Again, it's a very, very heavy decision for me to take। So that is why I keep repeating again and again, if you want these issues, we should have had people from the legislation here with us as well, knowing what they need to legislate in this country. These are our issues and problems. We never talk about them. We need help. We need guidelines. He needs to be strengthened. I need to be strengthened. It's not my responsibility. I can't take such a heavy responsibility. You are talking about ending life. It's a very, very grave and serious situation. ये वाकई ना रोज फोन पे हमें होता है हाँ होता है हमारे साथ के लिए क्योंकि हम रोज देखते हैं maybe a little we become a little nonchalant about it or anything else. But the fact remains it's a very, very serious business when you're considering life and ending life.
Thank you, sir.
In 2011, in PSA Rubber Printing chapter, this whole scenario which we are discussing right now was put in there. And they call Sharia scholars from two different sects and perhaps all the experts from ICUs and different anesthesia people, they were invited on that. But unfortunately, they were unable to make a consensus on that particular day. So that's a very wonderful opportunity. We are sitting here, we all are in the position that we can make a change. And what I would suggest, we should not leave this topic right here. We must work for it, and I think most of us can volunteer for it. We should make some papers. Maulana Sahib is with us. He can take us on the religious account, and we must do it.
So our third scenario is of a 37-year-old male. He had a road traffic accident. He had significant cerebral injury. He's been off sedation paralysis for over 72 hours, and he still has no conscious level. He's had a CT, venogram, and angiogram done. There's absent blood flow. He's had 2 sets of brain stem tests, and he has been declared as brain dead. Now, there is a question about organ donation. We have a young 16-year-old in the hospital who needs a kidney to survive. So, Dr. Taki, my question would be to you at the moment, what are the international guidelines for organ donation and how can should we consider it in Pakistan as well? And if we should, how can we go about it?
Yes, I've been following this conversation and so let me give a piece of mind. First of all, I have to ask a question of Maulana Sahib. Just to give a real life perspective. एक बंदा है उसके 2 पेरेंट्स हैं always loyal और एक जवान बेटा है पेरेंट्स से 2 घर में बेडरूम है पेरेंट्स पहले बेटा इधर बाहर बरामदे में सोता था पेरेंट्स अब वो बेटे की शादी का टाइम आ गया है पेरेंट्स दूसरे बेडरूम में रहते हैं now this child this boy would need privacy the parents because he is more likely to be a productive member of the society lead to progression of mankind to reproduction the parents really want तो क्या हम उसको कमरे में शिफ्ट करके पेरेंट्स को बाहर बरामदे में शिफ्ट करते हैं तो कैसा लगेगा सो दैट काइंड ऑफ टेक्नोलॉजीज डू अप्लाई ऑन दीस रिसोर्सेज यहाँ पे लिमिटेड रिसोर्सेज होती है डिमांड ज्यादा होती है पैराट्रॉपिक ब्रेन डेथ का इशू जो आ गया है उसकी वजह 3 है एक पहली एडवांसेस इन टेक्नोलॉजी व्हिच मींस what would have led to death in most of the circumstances of more than 150 years from now back are now sustainable or compatible with living now. आपका पहले होता था कि सांस रुक गया वही बंदा मर गया दिल रुक गया या नब्ज नहीं मिल रही तो बंदा मर गया बट इसमें even back in history and I know scholars सामने बैठे हैं इनकी मौजूदगी में गुस्ताखी है अगर करेक्ट कर दीजिए अगर गलत हो that Hanafi school of thought even Maliki भी करीब है and Al-Rashid भी उसी में है they all suggest that there has to be an irrefutable evidence of death before death is declared which means के बाद लोग कहते हैं कि even to the end of decomposition भी अगर आपको वेट करना पड़े तो आप उसको करेक्ट नहीं बन रहा हूँ पर लेकिन मैंने पढ़ा so अब क्वेश्चन यहाँ पे आ जाता है ये बहुत सारा इसलिए आ गया because organ donations का concept आ गया second because maintaining that life supports is expensive and resources are limited इसलिए आ गया कि now otherwise और इसलिए हमें death define करना पड़ेगा we still are not capable of properly defining that what we define is brain stem death and that is in order to facilitate withdrawal and to facilitate organ donation. If you strictly know, talk, even from the scientific point of view, we have still not been able to define consciousness. So how do we define that? And particularly when we say that there is brainstem that in the rest of the body is functioning, then put on a ventilator, this person may go on living in a sense that the rest of them even may reproduce having theoretical abilities. ब्रेनस्टेम डेथ के लिए क्राइटेरिया क्या बनाए गए हैं वो आपको पता है। ब्रेनस्टेम टेस्टिंग होती है, एक से ज़्यादा मौके पे होती है, एक से ज़्यादा एक्सपर्ट आते हैं और इसको अगर डिफाइन करने का या प्रिस्क्राइब करने की कोशिश नहीं करते हैं। So you go on, you are suspecting that this patient is brain dead, you go on to fulfill all those formalities and declare that person brain dead. And that at least in the US law, in the UK law, in the EU laws and laws in most of the countries. और अब इससे ये सारा even in few Islamic countries जहाँ organ donation, cadaveric donation का program start हो गए हैं, वहाँ पे भी उन्होंने इसको facilitate कर दिया। तो वो criteria ईरान पे भी अप्लाई हो रही हैं, अब सऊदी अरेबिया में जहाँ cadaveric transplantation हो रही है वहाँ अप्लाई हो रही है। They are the same criteria which have been brought in from the West. The idea purely is this is, and second, this is not a scientific issue. The science still is not able to answer this question. This issue is largely dictated by our social, economic, cultural, and everything all those, and largely actually driven by the drive for cadaveric organ transplant. So आपको पता है कि यूके के अंदर जब ये लॉ है तो उसके ऊपर there is an Islamic Council group of people who then have gone on and petitioned that please do not give and create an impression that this has been endorsed by Islamic scholars. I'll share that conversation with you.
Thank you, sir. So, can I ask you to respond to that?